you. Good morning, everyone. Esteemed delegates, I am going to present my topic. The topic is Hooch tragedy, an incident of mass alcohol intoxication in eastern India. This is the abstract. Alcohol-induced optic neuropathy is a life-threatening condition. It results in long-term or irreversible visual impairment and cause blindness. The most common cause is adulterated alcohol, that is methyl alcohol, and it depends on individual metabolic predisposition. Early diagnosis and treatment is still a challenge. So the mechanism of toxicity of methyl alcohol. Methanol first gets converted to formaldehyde by alcohol dehydrogenase, which is oxidized to formic acid. And the formic acid attacks on mitochondrial cytochrome C oxidase, which degenerate retina and optic nerve. So in our study, there were 20 male patients of age group 20 to 40 years presented to our hospital with blurring of vision. The range is 660 to no PL after intake of adulterated alcohol. And all the patients were examined by visual acuity, slit lamp examination, IOP measurement, fundoscopy, VEP, and OCT. So in total of 20 patients, 10 patients are within the range of the visual acuity 660 to 4 by 60, and 6 patients are having 3 by 60 to 1 by 60 vision, and 4 patients presented with CFCR to no PL. In fundoscopic finding, we found 12 patients having peripapillary edema, 4 patients having hyperemia of optic disc and venous engorgement, and 4 patients already started developing pallor of the optic disc. In slit lamp examination, 2 patients where there is no RAPD, 9 patients having grade 1 RAPD, 7 patients having grade 2 RAPD, and grade 4 RAPD in 2 patients. In VEP, we found 4 patients having normal VEP, 8 patients having prolonged latency period in the VEP, and no wave formation there was in 8 patients. In OCT, 10 patients having normal OCT, thinning of neuroretinal rim found in 8%, and 4% showed foveal flattening. Perimetry we have done in only in 12 cases because of poor visual acuity. We could not perform the perimetry examination in all 20%. We found central scotoma in 9%, altitudinal field defect in 2%, and centrocecal scotoma in 1%. So the management part, how we manage the patient? First, IV infusion 7.5%, sodium bicarbonate, loading dose of 180 milliequivalent, maintenance dose is 180 milliequivalent per hour, 2% absolute alcohol in dextrose with a loading dose of 0.6 gram per kg body weight, IV methylprednisolone, hemodialysis, injection methylcobalamin, and antioxidant. So we followed the patient for 3 months. So 14%, that is 70% of patient improved to 624 to 660. 4% improved to 636 to 660, but later deteriorated to 360 to CFCR, and 2% did not improve at all. So coming to the discussion part, toxic optic neuropathy is a reversible phenomenon. Formic acid accumulation in tissue causes metabolic acidosis and ocular toxicity. Visual loss is dependent on initial dose of methanol ingested and interval between ingestion and start of therapy. Significant association between the risk of thinning of RNFL and value of arterial pH measured at presentation. Pupil reactivity in the initial examination may provide important prognostic information for further visual outcome. Antioxidant and neuroprotective agent got significant role in toxic neuropathy in alcohol poisoning. So the conclusion part is methanol poisoning is a health associated disorder. pH is the best predictor for final visual outcome. Early diagnosis and prompt treatment is most important. Awareness in society is paramount, and proper documentation should be done in all alcohol poisoning cases. These are my references. Thank you.
Though it is looking funny, are you actively involved in this study?
Sir?
Are you actively involved in this study?
Yes, sir. Yes, sir.
Very funny question I am asking. Which brand of alcohol the patient consumed?
So the adulterated alcohol,
There must be a name for that.
Sir, desi alcohol, they make it, the hook, that means they prepare it, the common people, they prepared it. The labor low socioeconomic people.
Okay, local made alcohol.
sir.
Okay, fine.
Sir,
When patient presented to you?
sir, patient presented to the first.
Usually it is a social stigma. Patient came to us very late on 7th day or 10th day, like our 5th day.
Yes, sir.
Not
First, the
to
patients
no,
are
no,
admitted to the hospital cell
general
in medicine
hospital.
ward. From medicine, they gave us call and we examined the patient. Sir, within the 7 to 10 days. Sir, it was done in 2019 April. Yes, sir.
Before COVID.
Yes, sir. Yes, sir. Before COVID.
Before COVID. Is there any role
At
of
the election
steroid?
time.
Is there any role of steroid, bolus steroid?
Yes, sir. Yes, sir. Sir, steroid decrease the inflammation. Yes, sir. In the optic neuritis, first we give the steroid.
Okay, fine. Thank you. Sir, next.
Sir, 20 patients, sir.
Next, have you went to the spot? Dr.
Yes.
Jyotsna
No, sir. No, sir.
Sharma.
In this regard, I just like to recapitulate in the year 2012, I had got a very bad experience and rare opportunity to go to the on-spot of Hooch tragedy in West Bengal, in Diamond Harbour area, where I have seen on my own eyes 147 who have taken Hooch, adulterated Hooch, all were adulterated with phosphorus compound, so as to accelerate the action. How they are just being brought and dying in front of us without any treatment or some treatment within a couple of hours or so. Amongst those, around 34 patients having all those eye complaints got admitted to National Medical College. Only 7 of them were total blind, most of them were partially blind, only up 160 vision. And empirically, we have given them along with steroid others this brimonidine, and brimonidine was found to have got very good action, but not a very good vision, but at least some working vision was found to have amongst 14 of them. So that was our Hooch blindness, and that was the biggest Hooch tragedy in West Bengal. 137 people were died, and in total around more than 400 people have taken the Hooch from a particular area. All were adulterated with organophosphorus compound, ending a follicle like these things.
Sir, this Hooch is the name of that brand?
No,
It
sir.
was called as Haku, which is an English of this particular alcohol, Hooch blindness. In English literature, you can see Hooch.
That Hooch.
Yes, but in those areas, it is called Haku, Haku, Haku. They used to get Haku. But all were adulterated with this organophosphorus compound, just to get an accelerated action. They pinch of, but if the dose is high, this organophosphorus, then it will be poison. Otherwise, it's excellent.
So it's organophosphorus which is the cause for death in these patients?
Yes.
It is not, no, it is not the Hooch,
Due to organophosphorus,
not due to alcohol.
methyl alcohol. No methyl alcohol was there.
Okay,
Methyl alcohol, that was adulterated.
okay.
Any patient died in your study now?
No, sir. No, sir.
Next.